Stripes and bright stars through the perilous fight. O'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
All right, we'll get going here. Today's speaker is Mr. Joe Roberts. He's going to talk to us on some medical things, mainly deep vein thrombosis and embolisms. He's been in the medical device field for 45 years, and I'm just going to let him take it away. It's all yours, Joe.
That's scary. 45 years.
It's a long time, man.
Whoa. Okay. Anyone that wants a poster or a copy of this, please send me $10 and I'll pass it on to you. I'm not big with technology. You've probably already figured that out. But the subject is near and dear to my heart because it almost killed me twice. So what we're going to talk about is deep vein thrombosis and pulmonary embolism. The number of people that suffer the consequences of this are enormous. You know, every 30 seconds, someone in the world dies from PE. Half of the cases that go to the hospital end up in the emergency room when the patient is dead on arrival. They don't autopsy them. They just say, well, they had an MI. Where, in fact, half of them had pulmonary embolism. So what I'm going to do is I'm just going to bounce around because I like to bounce around. And I think we can probably get some benefit from bouncing around. When you talk to, I'm just going to, since I have such wonderful dexterity here. When you ask a young person or an old person or an in-between person about clot, their answer is almost always, I'm too young to have a heart attack. I'm too young to have a stroke. I'm too young to have, if they're more sophisticated, claudication, pain in your legs. All of that's arterial. And the fact that most people understand the vascular system as arterial, not arterial and venous. The venous system is much more complicated than the arterial system. And it has as many, if not more, critical issues. And I'll give you, as I bounce here to get the severity of what can happen with this. I listened to a man speak, probably 10 years ago, and he had written a book called 2 Kisses for Mandy. And the story went, his wife had 2 or 3 miscarriages, so she was at risk of having another one. And when she went into the hospital and they put her at bed rest for 10 days. So when the baby was delivered, everyone was just happy and relieved. And she was holding the baby, and she handed the baby to the nurse, and she stood up and she died right on the spot. She had a massive pulmonary embolus that just stopped her heart. Bang, that was it. I could tell you 55 stories of people that were once removed from me that went through this type of situation without even knowing it existed. And the man who wrote the book said, I thought the danger was over when she delivered the baby. No, the danger just began. And it's heartbreaking to me that when I get up every morning, and this is going to be, I like to overly dramatize everything I do. So when you get up in the morning, when I get up in the morning, I think to myself, by the time I get dressed, about 10 people died from this, maybe 20. And it's the therapeutic side of it has grown 4 or 5-fold. The public awareness side of it hasn't grown at all. So I do these because to me, if somebody walks out of here, one person, and as a result of what they gained from my jumping around and talking about this is my arch enemy. It tried to kill me, it missed, probably get me again, but I don't want anyone that I can reach to experience what I experienced. When you talk to a young person, for instance, my son's pharmacist in Wisconsin, she was 35, marathon runner, broke her ankle, got in a leg cast, ignored the pain that was increasing, thought it was orthopedic, which most of us would probably think. Got worse, went to the hospital with her 2 sons sitting in the emergency room. They put her in the CT scan and she said, I don't want to die today. And she died right on the spot. So what happens, is this understandable? Good. What I want you to do, because I don't have cards and this isn't my organization, this is a website that will give you tons of information on venous disease. You really want to see it?
No. Somebody might.
That's a good point.
It's a tough crowd.
I'm going to dance a little bit now. Give you a break. So, has everyone had an opportunity? I'll leave it here because you might want to sell that. So, there's nothing funny about this. Nothing. It's tragic. Horrible. And it's word of mouth. This is what I do with this. I go into Starbucks. The poor woman at the window, I start talking to her about PE, and she thinks I'm totally nuts. I make them write down PE, DVT, and tell 5 more people. Now, I have no idea how many of those people don't call the police and say I'm wandering around town, trying to educate people about PE. But this is what the venous system looks like, and I'm going to sit down because I'm old. The venous system, the arterial system overlays this. This is the vena cava. This is the iliac vein. And these are the leg. This is where DVT starts normally. So, in many cases, you don't have any symptoms until it gets up. It grows and it's into the cava, and you'll have a tongue of clot flipping around. And then, if you're unlucky, it breaks off and goes up here and goes into your right heart and blocks your pulmonary arteries, and your heart is pumping against pumping and pumping, trying to get blood through, and it stops. That's simply what pulmonary embolism is. If you're lucky enough to have it, the lungs are here. If you're lucky enough to have it distributed throughout both lungs, which was my case, then you, with anticoagulants and, pardon me? I'm hearing myself now. With anticoagulation and other devices like a filter they can put in there once they know you have it, a lot of people are able to recover if they're lucky enough to have been diagnosed. But I suggest, as I ramble along here, that when you go in your primary care doctor or internal medicine doctor to have anything, if you have a knee replacement, orthopedic consequences of DVT are higher than they tell you. So you need to ask, am I at risk for venous clot that might be extremely dangerous for me? Because if you don't ask, they're not going to bring it up. They may bring it up 40% of the time. They may bring it up 20% of the time. They may not bring it up at all. So some of the other things, this is May Thurner. That means a natural compression of the iliac vein, especially in women, on the left side, where the ligament of Treitz rests on the vein and it causes a narrowing, which is a perfect location for clot to start building because you don't have natural flow. You have compromised flow. Other things that can play a role in this. For instance, a friend of mine is an interventional cardiologist close to Ohio State. He's treated 17 female athletes for this. Dehydration, birth control pills, a coagulopathy problem. All of those things can create a perfect storm. Serena Williams, I actually almost got to her as a spokesperson. She got off the plane years ago, coming back from a series of partying and dropping out of the Australian Open, and as she landed in New York, she called her sister and she said, I must be in terrible shape. I'm having trouble breathing. Now, the only reason she's alive is because Venus's trainer overheard the conversation. And he said, you go right to St. Luke's Hospital. She said, no, I'm going home. So he was at her door knowing that, world-class athletes can be a little stubborn. If it wasn't for his diligence, she would have died. And he got her to the hospital. And she got it again when she delivered a baby. Even though she told him, look, I had pulmonary embolism. They just blew her off. This is one of the areas where you have to know this is out there. It's not something that happens to a few people, rarely at all. It's something that happens a lot. So, look at that. I'm done. No, I have some more things to bore you. Another horrible thing that can happen here, that happened to a friend of mine recently, his daughter, all-state basketball player. She developed clot in her leg, and it propagated, grew, went into into the right side of her heart, and guess what happened? 1% of us have a communication between the right side and the left side. And when the pressure rises, that clot blew right through, and she had a massive stroke. because it got to the arterial side of the system. Pelvic congestion, many women haven't been diagnosed with pelvic congestion, and they'll end up killing themselves because they are pushed through the system and they ultimately get to the histrionics or hysteria, and they have nowhere to go and they land up hopeless. So the things I'm talking about are things that you normally don't hear because it doesn't have a international face like the breast cancer and prostate cancer what happened? So there's no public face for it. You know, I've tried to get people with a lot of money who have had, you know, with the HIPAA laws that have had either PE themselves or their wife or children or whomever. But it's some of the things you can do is when you're going on a long trip, hydrate, wear compression stockings, they work, and pay attention to your body. You know, if you develop some swelling in your legs, you know, follow up on it. Talk to your doctor and make them aware that you know that this could be a problem that you might be having. I think since I like to talk to myself, I'd like to open this up to any questions you have. Yes.
What do the compression socks actually do?
They keep the fluid from gathering in your lower leg, which can compress the veins, which can, you know, the thing you have to remember about venous clot, venous disease, is that with arterial narrowing, you have end organ consequences. You have a stroke, you have a heart attack, you have kidney failure, you have claudication, which means a stenosis, narrowing in your leg, in your popliteal artery, and your iliac artery. All of those things have end organ consequences. With venous disease, the end organ is the skin. So this doesn't just have an acute phase, it has long-term consequences that are horrible. If you ever go into a wound clinic and see wounds that are the size of quarters that won't heal, that's chronic venous insufficiency. Yes?
Yeah, last year I was diagnosed with orthostatic hypotension, which is swelling in the leg. And it's due to the polio that I had as a child, because the polio attacks the nerves, and then as they grow back, they're never as strong as they originally were. And so my nerves are starting to weaken, which keeps the blood from being pumped up to my brain, and I had issues with passing out due to that, where the blood had always ended up in my legs. And I went to a neoprene wrap for my legs, which has Velcro attachment, a lot easier than the compression wrap. And it works well.
Yeah, that's also used for lymphedema and things like that, and it does work and it makes sense. It's trying to think of the issue of chronic venous disease you should be aware of, because it has a large number of patients, and it essentially is started by improper diagnosis and improper treatment of venous blockage in the lower leg. I have CEP4, where you get skin changes, you get neuropathy, then you develop an ulcer, and the ulcer has to be debrided, and the valve, there are valves throughout this whole system too, which I didn't mention. Arteries don't have valves. So you get an incompetent valve, and of course the ability to move blood back is decreased because you don't have the valve that's supporting that column and pushed back to the heart. So it's a very complex system, but yes. Symptoms you could look out for, and this is no guarantee that you'll have symptoms, but probably 70% of the people develop symptoms, and that would be swelling, pain, redness, warm to the touch, and if you develop that in your leg, it's time, when you start having symptoms, you go in to your attending, and they'll do, probably the most reasonable thing would be an ultrasound. That's the first step to diagnose DVT, is an ultrasound. Yes?
How about the baby aspirin? Is that thin? Is that some therapeutic? Baby aspirin?
Yeah, that's a controversial question, but see, I'm on Coumadin, rat poison, because in perpetuity, I run an INR of 2.5.
Aspirin, one baby aspirin, decreases the ability of blood clot 50% for 2 weeks. So if you get on an airplane, that will control bleeding. That's a good idea to take a baby aspirin before you go on a long flight.
Sure.
Also, if you have cardiac disease, like I do with stents, they put you on baby aspirin because they don't want it to clot.
Yeah, that's reasonable. They also have a whole host of new things. But the baby aspirin, I wouldn't argue one way or the other. In the beginning, it was a slam dunk, and then at meetings, they started hedging on that. But I would not take it based on the information I've seen. Yes?
Isn't it true that lifestyle contributes a lot? In other words, people standing on feet, dentists, physicians, barbers, people who work on restaurants, food services, they're have to undergo hemostasis and make a lifestyle. And hereditary. A lot of it's hereditary, isn't it?
Well, once again, there are so many factors in this that, for me as a layperson, I'm not a doctor, obviously, but as a layperson, if you follow the symptoms and you demand a thorough analysis of why you're having those symptoms, you're way ahead of what most people get. So you have to be an informed patient. And that's the only purpose I serve in this, because most people have no idea what this is. And, but addressing your question, sure, that would be, if you're on your feet all the time, as you age, and if you happen to be overweight, a concomitant to that could very easily be venous problems. Yeah, I think there's some evidence to that effect. You're not, 1% of the population has coagulopathy issues, which is a bell curve. So what they're doing, if they were willing to test everybody for coagulopathy issues, it would be in this bell curve. Now, there are a multitude of other possibilities in terms of coagulopathy problems. Factor V Leiden is usually when a young person develops DVT, a young female, because of birth control and being athletic, dehydrated, the whole deal, going, you know, the perfect storm can happen, and if you ignore it, the perfect storm can turn into a life-threatening situation. The whole message here is know about it, know what some of the symptoms are, mention to, if you go in for a joint replacement, make sure you talk about, because they didn't talk to me about it. And I knew about it, and I went along with it anyway. So you have to be informed, and you have to be, you can't let somebody determine the outcome without proper information. Can't. And, you know, it's, yes.
For years I was on Coumadin, and about 3 years ago, my PCP took me off. Am I flirting with disaster? I feel great. I don't have many symptoms, but it begins to make me wonder, should I be on anticoagulants?
Well, I'll tell you what happened to me. I had a hip replacement, and I developed DVT and PE. That was an event that they could correlate to something that had a higher incidence of clot. So they put me on Coumadin. First, they put you on Lovenox after surgery, and they took me off Lovenox probably a week earlier than I should have, because at that time it was expensive. But about 3 years later, they took me off anticoagulation. And then out of the blue, I developed another PE. So they had no idea where it came from. They had no idea why I developed another PE. But the answer was, you're on Coumadin in perpetuity. You're on it for the rest of your life. So I have my own monitoring machine where I take a blood test and stay within the range that I'm supposed to be in. So that's what happened to me, because they couldn't correlate it to another event. They did my blood panel a number of times, and I didn't have any coagulopathies. So I'd ask your physician, because they have Eliquis, they have 2 or 3 Cadillac drugs now. I mean, Coumadin is about 2 cents a bottle. And the other drugs are, as you know, much more expensive.
I think it might be worth mentioning that it's a good idea for anybody not to sit for more than 2 hours at a time.
Yep.
All you have to do is get up and walk around the room, or driving, you walk around the car, and get back in and go at least every 2 hours. And that's because of venous stasis and
Yeah.
flooding.
No, that's an excellent point. That's something that should be part of that. Yes.
I went through the same thing you did. Embolisms, DVT, about 9 years ago. 66, I was an athlete, ran every day, all that kind of, totally, every symptom you quoted, I went through it, ignored it until I got the classic hot pain, hot leg. I've been on Xarelto for 9 years now. Never going to get a chance to get off of it. The point I'm asking you is I go to a hematologist every 6 months. He runs a specific set of blood tests. So my question for you is that something that a normal person, since it's insidious, you can't typically see the symptoms coming on, that you might, particularly if you have a family history, that you might ask your doctor to run a see a hematologist or run special blood tests. Because I have a discussion with him every year, and I always want to get off of this stuff if I can. He won't let me. He said, your blood has got I got something in my blood.
Yeah.
He says, no, you got to be on blood thinner for the rest of your life.
They probably won't do it. That's what depending on the argument, you're obviously informed, you've had it, you have concerns, you have questions, but running a profile for coagulopathy is not cheap. And, ideally, we should all have it. I mean, if the percentage of people that develop venous clot is relatively high. So, no, I would ask them again because you have to do that. Poor doctors are under such incredible duress because of managed care medicine. Managed care medicine is all about money. It has nothing to do with medicine. So they're not in a good spot. And the last person in the world I would criticize is a doctor. I worked with them for 45 years. I have the utmost admiration for what they do, how they got there, and what they face. So this has nothing to do with bad-mouthing doctors. As far as CEOs, that's a different story.
I was advised years ago, I wanted to pass come up, raise my feet at night slightly above my heart. Help. Not get blood down into my lower extremity. Intel on that.
No, that's a good idea too. I think the most important message to this, to what I'm trying to deliver, awareness, because awareness is almost non-existent. And if you take a composite of the things we talked about and pay attention to, yes, if you get on a plane, as you said, a baby aspirin, elevating your legs, getting up and walking around, wearing compression stockings, doing anything you can do to make you at less risk, you should do. And certainly, I've been in wound clinics. I've talked to people that specialize in congestive pelvic disease, which drives women crazy, and they're treated very poorly because they're not evaluated fully. And the most dangerous clots are where? They're not these. The pelvic veins are like this, and you can't see them well in imaging. It looks like a whole bunch of snakes. And that's where I believe Serena Williams had her problems. She blew a pelvic clot, and the bigger, the more dangerous. These aren't going to, in most cases, cause a PE. But if they keep on growing, the vessel gets bigger and the clot gets, and then it gets into the vena cava, and it's just flapping around until it breaks off and hopefully doesn't get main pulmonary artery. Yes, sir.
Yeah, I had 2 DVTs, and they told me not even to cross my legs because it would impinge on the.
Yeah.
So they said when you lay flat and don't cross your leg, don't put any pressure. That would cause the clot.
All of those things are extremely important. I think another part of this message is I talk to young people as much as I can because the reason they make great soldiers is they don't think they can die. And the same thing is true here. When I talk to an 18, 19, 20-year-old guy and I talk about venous clot, they look at me like, you must be from Venus. but they just can't comprehend. Clot to them is correlated to the heart, to the brain. Well, I'm young, that's not gonna happen to me. But it happens to them all the time. And those stories, the younger the patient, the more heartbreaking it is. I'll tell you a story about what got me into this. I worked on medical devices for years, but most of them were arterial devices used in the heart, the brain, the legs, biliary tree, the kidneys, the whole spectrum of things. But none of them were used in veins, with the exception of a hemodialysis catheter, central venous pressure catheter, things like that. So I had the impression that I had a pretty good knowledge of what could happen in veins. I had no idea what could happen in veins. But serendipitously, a good friend of mine, a physician who is no longer with us, he gave a presentation on a venous valve, a prosthetic venous valve, very primitive. And what that would do is that ideally, and they still haven't perfected it, it would replace incompetent valves. Because once a valve loses its ability, and it's a very sophisticated anatomical structure, they're not working, you have blood pooling. Blood is not getting back to the heart. So ultimately you're gonna have problems. Even if you don't have PE, you're going to have horrible problems with ulcerations on your legs and a whole host of things. But the reason I got into this mainly, I played basketball with a guy that played for the Pacers. And he was like the ultimate stud, And in everyone's mind, people like that don't get sick like this, when you're talking about. So he was on his honeymoon, and he was having fatigue and shortness of breath, and he thought, I must have the flu or something. So he got back from his honeymoon, went to the hospital, and they put him in a room, and they left him there. And they were running some blood work and blah, blah, blah. So at 2 o'clock in the morning, he told the nurse, he said, if somebody doesn't do something, I'm going to die. Because this is sort of the mystical side of this. 10% of the people that develop PE or MIs develop post-traumatic stress. And papers have been written, and there have been podium speeches about that. So he had a sense that he was leaving. He said, I can't breathe. And they went down and they did a workup, and both his lungs were loaded with clots. Now, he was in the hospital, but if you looked at him, you would think this guy is not going to have. It's not an adequate correlation, but it's natural. You expect clots to happen in older people. Of course, I'm not an older person, so I wouldn't know what that was. So, now we're going to do karaoke? No? Any other questions?
Short meeting today.
Thanks for
Thank
the
you, Joe,
time.
very much.